Good afternoon, everyone. We're excited to have you here with us today. Let me start by asking, how competent are you in combining both Eastern and Western approaches to treat musculoskeletal conditions? Today's course will guide you on how to integrate orthopedic assessments with acupuncture to enhance your patient care. My name is Myra Chen, and I'll be your host and moderator for today's eLotus webinar. As many of you know, eLotus has been delivering high-quality CEU content for over 30 years, featuring more than 200 expert speakers and over 3,000 hours of CE. In today's class, Integrative Musculoskeletal Health, Orthopedic Assessment and Acupuncture, Dr. Rosanna Gregory will guide us through key techniques for assessing, diagnosing, and treating orthopedic injuries using acupuncture and specialized body movement analysis. You will walk away with practical tools to enhance your patient care and support long-term recovery. Today, we are especially thrilled to introduce Dr. Rosanna Gregory, a new speaker to the eLotus family. Dr. Gregory brings a unique perspective with her extensive background in traditional Chinese medicine and a strong foundation on orthopedic and bodywork therapies. She has a deep-rooted passion for integrative health, having grown up learning non-invasive healing methods from her own family. This passion has led her to open her own herbal store where she promoted healthy living through local produce, herbal care, and exercise. After becoming inspired by Chinese medicine, Dr. Gregory pursued advanced studies, earning her PhD in integrative medicine from PCOM San Diego and her MTOM from Emperor's College. In addition, she brings over a decade of teaching experience in bodywork therapies like shiatsu, craniosacral therapy, and Tui Na, blending Eastern wisdom with modern techniques to address musculoskeletal conditions holistically. Now, before we begin, a quick reminder to set your chat from host and panelists to everyone so that everyone can be part of the conversation. If you have any questions during the webinar, please use the Q&A box. And lastly, the quiz. The quiz for CEUs will be available the next business day late afternoon for everyone with qualifying attendance. Now, without further ado, let's give a warm welcome to Dr. Rosanna Gregory.
Hi, everyone. Thank you for joining me today. I really appreciate seeing you all here. And I just hope you know I've been in practice since 2006. And my goal is just to make this look a little bit more effortless. It's been in my studies for the last 30 years, but the key is to make it look simple. So we're going to share my screen and we're going to jump into the PowerPoint as soon as possible. And then if I have enough time, I'll be able to answer your questions after, okay? Has everyone got a chance to see the screen?
Yes.
Yes, thank you.
Great, thank you. So there's the reason why I chose musculoskeletal systems is because I started off as an herbalist, but went into massage therapy. And back in the studies, when I first started massage therapy, you had to write everything down. Nothing was ever given to you. Origin, insertion, and actions was like bread and butter to me. So if I'm going too fast, let me know. I'll slow it down. If I'm going too slow, I'll speed it up. We're going to start off with the class outline, which is going to talk about the origins of orthopedic assessment. And then we're going to go into the main contributors into this particular Western dominant history. Types of joints as well as body movements and muscles is going to be applied. We're going to go into common injuries. I'm going to share some points, some real good points that I use a lot too. And some TCM treatment and even including some herbal supplements that I know are effective. So let's start off with the history. So the term derived in the 1700s, but it was used throughout the time period, including the Egyptian era. And when we talk about the Egyptian era, the Egyptians, they were just fascinating when it comes to medicine. But when it comes to orthopedic assessment, it was really more about tailoring around their problem than it was actually fixing the actual problem back then. So until the Renaissance era, treatment was more from amputations. And this is around the 14th century to the 17th century. Surgery started to advance as modern medicine in Europe evolved and was used to try to correct club feet mainly. And mainly disabled were wheelchair, they were cart bound, and they were also they had to literally crawl on the floor. And this was back in the 18th century in the Western Hemisphere of Europe. Physical assessments became more useful in the modern physical therapy. And today we have, I gotta get this out of my way. Today you may be avoiding a lot of problems, and if you're really able to properly assess people. So the main people that I've learned from as far as the origin of the medicine is Dr. James Henry Cyriax from 1904 to 1985, Sir Robert Jones, 1857 to 1933, and Nicholas Andre from 1697 to 1742. Those are their lifespans, so I think they're kind of important, and they play a role in medicine, don't they? So starting off with Nicholas Andre. Andre had the tree of Andre, which is a picture of an illustrated crooked tree being bound and straightened by a beam behind it and a rope. And it was his first time ever noting the term orthopedic. And orthopedic, actually, with the AE, it means to straighten the child, not like orthopedic, which is physically to walk. So the path to medicine, it came out around this time period with his book called L'Orthopédie in 1741. The path to medicine was more emphasized on diseases, where his first publishing earned him the term the father of parasitology. His concepts of utilizing physical therapy over barber surgery. And I'm not sure if you guys know what barber surgery is, but you could always look it up in YouTube and have a fun time, but it was pretty nasty. And Andre actually had a background of physicians as parents, and there was a lot of cruelty that actually made him and prompted him to use non-invasive tools to be able to create this type of medicine. And this type of treatment protocol was actually predominantly used on children to help from the growth period on. So the tree of Andre shows a crooked tree being supported by a strong beam, stable behind it, strapped with a rope to assist the tree to continue to grow in a healthier alignment. That's what orthopedic really means. And then we have Sir Robert Jones from England. He was noted as the orthopedist. He, along with his practice, assisted from only helping children to advancing to adults with moderate deformities. He trained and he designed instruments for surgery, as well as incorporate radiology for more precision prior to surgical intervention. In his younger years, he was an apprentice for his uncle, who tended to fractures, and he learned how to create a lot of brace products. He attempted to establish the first British Society for Orthopedic Surgeons, met with many foes, who were general surgeons versus the specialty we call orthopedics. In that subject, a lot of people were considered like surgeons, and then there was orthopedic surgeons was their specialty. And there was a lot of what we call branding that Sir Robert Jones did. Like, he branded his instruments, and you would have to pay for these elite classes to take and learn how to use these instruments. So that was part of the reason why the controversy started up and the organization broke away. But he also was able to publish a book called Injuries of Joints, and that was in 1916. It's a remarkable book of assisting the specialty in isolating better diagnosis and proper care in treating fractures with orthopedic surgery. And now we have our last, but my never least favorite, Dr. James Cyriax from 1904 to 1985. So orthopedic is a baby, isn't it? Main contributor to design clinical assessments to diagnose and treat soft tissue. So all the other ones were more concerned about your growth and development, the bone structure. It was Cyriax who really did believe in soft tissue work. He used body movements in these assessments, and he took studies further into designing manual manipulations to assist in correcting cases that did not require surgery as much as physical therapy, like PT. And he's noted as the father of orthopedics, mainly for his cross-fiber friction technique, and is utilized still in current physical therapy, sports medicine, chiropractic, and massage, including advanced techniques. In fact, Dr. Cyriax, he comes up a lot when it comes to Rolfing. You can actually look him up in Dr. Janet Travell's quotes. And there's some fascinating things about Cyriax, but when I get further into the topics of working on actual conditions, you'll see a lot of his type of work therapy that I learned is going to be incorporated in my assessments. So we're going to jump into types of joints. And before I talk about types of joints, everybody, I hope you know what a plumb line is. A plumb line you can imagine anywhere. So you're basically a carpenter and you're looking for a straight line like a pendulum to drop down, and you're always going to look for the center. So your top of your head to your shoulders stacked, and then you have your hips strapped on top of your shoulders in alignment with your knees and your feet. That's a functional plumb line. So always look for them as we go through this part of the lecture. So we're going to talk about types of joints. Well, we have three main ones. We have fibrous, we have cartilaginous, and we have synovial. Fibrous is the one that doesn't move. It's not supposed to move, is it? Well, the skull actually is the one that's the most fibrous. And the skull's joints are known as the sutures. The sutures are actually there for good reasons, is to make sure as you're growing and as the growth plates start to settle, everything is in alignment. And after you get to a point where you're past 8 years old and the growth of your brain and everything's developed in the pumpkin, so to speak, it's still soft till you're 8 years old on the fontanelle. That's the last area to grow. But the actual last bone to grow on a human form is the clavicle. So by the time you're 28, 29, that should be fully grown. But in this particular area of the skull, the sutures are very necessary, even in adult format, because that's where the blood filters through the skull, becoming cerebral spinal fluid. So just because you can't move them doesn't mean you can't manipulate them, so to speak. And then we have cartilaginous joints, and these are what they call semi-mobile, and they're semi because they can't do full range. And the main areas that you're going to look at with that area would be the vertebrae, because they can flex laterally and they could rotate, which is really almost like a pivot, but they don't necessarily completely go full range around. The most free and the most movable are synovial joints. And where you see synovial joints, not always will be synovial sacs. There may even be more fibrous tissue around them, and we'll get into detail. But those are the main ones that we're going to be focusing on in this lecture today. So we have ball and socket, we have hinge, we have saddle, condyloid ellipsoid, plane, gliding, and pivot. Ball and socket is your shoulders and your hips. Hinge would be your elbows, and sometimes even your jaw is considered a hinge. Saddle, my favorite, which is actually your thumb, sits right in there like a saddle. Condyloid and ellipsoids are at the wrist and at the ankles. And then you have plane gliding, which are also in the wrist, the vertebrae, and the pivot. The pivot is C1, C2.